This video is a quick introduction to the proper positioning for a scapula radiograph, the AP and Y view. In order to successfully accomplish this examination, you're going to start off with a 10 by 12 image receptor placed within the wall bucky and portrait. The wall bucky should remain 40 inches from the X-ray tube to achieve a 40-inch source image distance. Let's go ahead and have our instructors demonstrate how we would accomplish this examination. You're going to start with the patient erect with the back against the wall bucky. In a few seconds, you're going to see our instructor gently abduct the patient's arm to a 90-degree angle and supinate the hand to remove the arm from the area of view and place it in a salute position with the palm out. Notice that the center ray is perpendicular to the mid-scapula, which is approximately 2 inches inferior to the coracoid process, or right at the level of the axilla, and approximately 2 inches medial from the lateral border of the patient. The center ray, again, is going to be directed to the mid-scapula. The top of the image receptor should be approximately 2 inches above the shoulder, and lateral border of the image receptor should also be approximately 2 inches from the lateral margin of the rib cage. Notice that there is no angulation of the tube, and the letter marker should have been placed lateral and at the very top part of the image receptor within the light field. In order to successfully obtain the image, you're going to instruct the patient to remain still and ask the patient to just continue breathing gently. This is referred to as orthostatic breathing. While the patient is breathing, go ahead and obtain your exposure, after which you may tell the patient to relax, enter the room, remove the image receptor from the wall bucky, and run it through the processor in order to obtain your radiographic image. Once that is accomplished, you are now ready for your next exposure. Side note, please make sure that you properly shield the patient, placing a lead apron between the patient and the X-ray tube. Now we're going to rotate the patient in order to achieve a scapular Y lateral view. In order to obtain this, again, we'll be utilizing a 10 by 12 image receptor in a portrait mode, placed within the wall bucky, and ensuring that there is 40 inches between the wall bucky and the X-ray tube. Have the patient standing erect facing the wall bucky, and have the patient reach across the front of his or her chest and grasp the opposite shoulder to demonstrate the body of the scapula. Palpate the superior angle of the scapula and AC joint articulation. You're going to want to rotate the patient until an imaginary line between the 2 points is perpendicular with the image receptor. This will result in a truly lateral position of the body of the scapula. The center ray should be perpendicular to the image receptor and located about 2.5 inches below the top of the shoulder. No angulation of the tube should have taken place. The marker should have been placed lateral and at the very top of the image receptor within the light field. When you're ready to take this image, go ahead and instruct the patient to remain still and hold their breath. After taking the exposure, go ahead and tell the patient that they may relax and breathe normally. Enter the room, remove the image receptor from the wall bucky, and process it through the processor in order to acquire your radiographic image. Again, make sure that you provided a lead shield between the patient and the X-ray tube to protect the patient from the harmful X-rays. Also, make sure that you closely collimate to the area of the scapula, both in the scapular Y and the AP scapular view. When you're doing the collimation, you're going to want to make sure that you collimate enough to where the scapula is the focal point, but not so much that you are cropping away vital areas within the scapula, being that the scapula is the main bone that we are trying to look at in this view. Now that we have shown you how to properly position a patient for an AP and a PAY view of the scapula, let's go ahead and see what those images should look like. Here we have an AP view of the scapula. You should be able to see the entire scapula in a truly AP view. You should be able to see the lateral border of the scapula, the inferior angle of the scapula. You should also be able to see somewhat of the ending portion of the clavicle in the very top of the image receptor, as well as the coracoid process and the glenoid cavity. Here we have what a wide view of the scapula should look like. Notice that the humerus is going in line with the body of the scapula. So it's superimposed upon the body of the scapula and therefore forms that Y shape. The acromion as well as the coracoid process form the top portion of the Y view. The head of the humerus should have been also identified in the very top of the image receptor. This is what a successful Y view of the scapula should look like. This concludes a quick introduction to the proper positioning for a scapular radiograph, AP, and scapular PAY lateral view.